what is the one most important development reflected in our study? Well, our study has found that breast implants may be associated with a significant impairment in the ability to breastfeed, with an odds ratio of 0.45. Among these patients, however, breastfeeding complications were found to be rare. Although the majority of females with breast implants who attempted breastfeeding are able to do so successfully, this finding is particularly important for those who plan to breastfeed in the future and should be incorporated into future discussions of informed consent. With the increasing popularity of both breast augmentation and breastfeeding, we highlight the need of more high-quality evidence in this area.
What advice would you give a colleague or trainee who wants to implement or replicate this procedure/technique? Well, we would recommend conducting a systematic review and meta-analysis in accordance with PRISMA guidelines. This allowed us to review and analyze the current available evidence on breast augmentation and its effect on breastfeeding. For colleagues or trainees interested in this area of research, we highlight the need for standardized outcome measurements for future studies on this topic. This would ensure consistency and comparability across studies. Additionally, it is also important to consider longer timeframes for follow-up to study the long-term effects.
What's next? Additional clinical studies are needed to further clarify the relationship between breast implants and breastfeeding complications. Although preliminary studies favor certain incision types and implant placements, more studies are needed to determine the optimal surgical approach and implant type for future breastfeeding. Ultimately, we hope our research may inform future patients who are considering breast augmentation and aid healthcare providers in optimizing breastfeeding outcomes among their patients.